Perfect. So we should just be waiting on a few more people coming in. Ashir, what we'll do is we'll just give it about a minute or so, let people in, and then I'll get started straight away. Yeah.
Sounds good.
So again, like last time, guys, if you can just go onto your phone and just go to www.menti.com and just type in this code, it means that I've got a few questions coming up on the next few slides, so you can at least answer it, and other people can see your answers on the screen. So I'll just give you about a minute or so just to log in. So it's just at the top, menti.com, and that code there's 58537406. Perfect. So just to give a small summary of today, today's going to be quite a short session. It won't be, probably we'll get nearly close to an hour. I'm expecting about 45 minutes. The whole point of today is just giving you some tips and tricks in terms of starting preparation. One of the most common questions I got asked last week is, Shivam, I don't even know where to start with my Ucat preparation. I don't even know basically anything about it. So today I'm just going to give a nice summary of each section again, go through some tips and tricks for each section, and hopefully then from next week we'll be going through each section in a bit more detail. So going through particular questions, how to solve those questions. But today, definitely ask about any general questions that you have about the Ucat still, if you're a bit confused about how it's scored, the format. That's something, again, I can clarify today. But the whole purpose of today is to give you that kind of brief overview of each section in terms of a few tips and tricks that I do have, so that now we can really start going through practice questions. You can start looking at the online resources that we have as well, and just getting into good habits. That's the key for today. So again, just a bit of a summary. I want everyone to be absolutely clear with this timeline, absolutely clear. July to September is that Ucat. So in the next month or so, you should be able to actually start booking the Ucat. I would recommend booking it in that first half of from between July and September. So I'd highly recommend choosing July and maybe the start of August. Don't book it in September. Try not to book it in September, because statistically people who book it a bit earlier do better, and that's because you're getting into good habits earlier on. And if you do need to change the date to the exam, you can book it a bit later. Again, in the back of your mind, you should be thinking about that personal statement as well. Maybe start getting a piece of paper, just a blank sheet of A4 piece of paper, and start writing down 5 of your proudest achievements. That's something that I would recommend doing over the next few weeks. It's a nice way to start off. You can actually say to yourself that you have actually started your personal statement. So just get an A4 sheet of paper and write down 5 of your personal, proudest achievements. And then next to it, write, what did you learn from those achievements? What did you gain from, for example, being the captain of your football team or taking part in your cricket team? And a competition that you might have won. What did you actually learn from it? So those, it's a nice way to start. Starting is the hardest part. Starting revision is always the hardest part, but once you start, you get into good habits, like I say. So I just want everyone to be really nice and clear with this timeline. With the Ucat, it's coming soon. It's coming up in July. So starting that preparation early is the best. So just a general question here. So what does everyone think they would struggle with? So what do you think you'll struggle with the most on the Ucat? Any particular sections? Any particular questions? So time seems to be a thing for sure. Time management. Can anyone just answer in the chat why is time so tricky? So what is it about the time pressure? What makes time difficult in the Ucat exam? So is it because of the style of question? Are the questions really difficult? Yeah, Jack's absolutely right. There's lots of content to process for sure, especially in verbal reasoning. There's lots of questions, but little time to answer those questions. So I spoke to a student the other day and I said to them that the UCAT itself is not actually a tricky exam. It really isn't. You know, the questions fundamentally, if I gave you a question right now, I think everyone would be able to answer it in 2, 3, 4 minutes. But the trick to it is the time and the lack of time that you have, and that's why it's very pressurizing. We don't have these types of questions, like Asima said, in school. We don't really learn about this in school. And that's something that I want to go through today. I want to start picking up on some of these particular topics like abstract reasoning, talking about verbal reasoning and the numeracy section, and really just start thinking about how can you manage that time? What are some easy tips and tricks that you can start implementing quite early on? So again, if you're not on the WhatsApp group, please just scan this or scan the QR code. I think it should be it should be on kind of a slide at the end, shouldn't it? But if you just put the link in the chat, Ashir, that would be really useful.
Yeah.
So everyone can join that. Perfect. So again, just to recap from last week, we talked a bit about when the UCAT is, how many sections there are, how to revise really, when to start revising, and what universities use it. So about 80%, 75, 80% of the medical schools require the UCAT exam, and that's why it's so important for preparation. And again, just to be very, very clear with the timings, again, take a screenshot, take a picture of this, hang it up on your wall, maybe make a nice A4 sheet of paper, stick it on your door, stick it on your wall, put it on each room of the house if need be. But get used to this timing so that in the back of your mind, you know how much time you have, how many questions for each section. So you can just start to realize, for verbal reasoning, I always know off the top of my head, verbal reasoning is always half a minute. It's half a minute per question. I always know that. And for decision making, I always know that I've roughly got about a minute for every single question. Okay. So make sure for each one of these sections, okay, if your mum or dad asks you, oh, how many seconds do you have for each question on abstract reasoning, you should be able to actually tell them. And that shows good insight into timing, because everyone keeps on saying timing is really tricky. Well, why don't we make that the priority then? Why doesn't everyone start really honing in on the time and knowing the exact timings for the UCAT exam? So really important, something to be aware of. Perfect. So in terms of just general tips here, so I've talked about this already, getting to grips with the test format and most importantly, the timing. Okay, so understand how the time works, start memorizing the timings. The key part is also making use of the UCAT official practice tests as well. Again, on the Medic Mind website, we have lots of practice questions that you can use in addition to the UCAT official. And this is quite an important one. Practice the exam in a library setting. So again, what this comes down to practicing in that kind of real environment. Obviously, you can't go to a Pearson test center and ask them, oh, can I practice today here and just practice some UCAT questions? Of course, you can't do that. I remember when I was sitting my UCAT, I was trying to think to myself, how can I make this as realistic as possible? And one day I said to my dad, can you just get a big piece of cardboard, just a big cardboard box? And he bought it and he was like, okay, Shivam, you must be crazy. I don't know what you need this for. And what I ended up doing is splitting that cardboard in half and putting one side on the right and one side on the left, just to replicate what the exam would be like in terms of having those kind of two kind of dividers but next to you, because obviously you can't look at what the person next to you has on their screen. You're kind of in a little box. So I try to replicate that box just by using some cardboard. So again, just think about how can you replicate it? Maybe practicing a lot more in the library in a quiet setting, and just replicating as much as possible is really, really useful. Another thing, I know that one of my friends, he actually, was a bit outrageous with this, but bought the exact desk that they use in the exams for his GCSE and A-level exams that they use at school. So that floppy desk that you can move up and down. He actually bought one himself just so that he was used to that desk. He felt comfortable with that desk. So this is what I'm trying to say is from as early on as possible, let's start becoming comfortable with the types of questions, the timing, and the environment. Okay. So in terms of how long does it take? So how long does it take to prepare for the Ucat? So again, anyone can turn the microphone on or just put in the chat. What do they personally think is good preparation time? What do you think? You can turn your microphone on, just put it in the chat. So 6 to 8 weeks is generally what a lot of people tend to go for sure. And I think that's a good amount of time. And then this kind of follow-up question now is kind of how many questions do you think you should be doing every day? So how many questions roughly should you be doing every single day? Yeah, so Joe's right. About an hour's worth, I think, is a good amount of time to be. If you're starting your preparation now, that's definitely what you should be going for. I recommend somewhere between 50 to 150 questions every day that you should be practicing. And again, that's really important to understand, because loads of people ask me, Shivam, I don't know if I'm going to run out of questions. And I tell them, if you're aiming for about 50 to 150, you can, from today, for example, you have all the Medic Mind questions that we have on our website. You have the Ucat questions to use as well. Okay, so plenty of resources. Perfect. So let's just talk a bit about verbal reasoning and just a few tips and tricks. Again, don't look at everything all at once. Let's just go through this very methodically. So starting with number one. So using our keyword technique. So this is something that from next week, I'm going to talk about in a bit of detail. So I just want everyone to do maybe a bit of homework for the next session. You know, look up a bit, what do I mean by the keyword technique? So does anyone know what it is exactly? What do I mean by the keyword technique? So I'll just kind of summarize briefly. The keyword technique is choosing particular words in the extract, in the passage, and basically what you're trying to do with those keywords is they're usually the big verbs that they use, or they're normally pronouns. Okay, so names of places, names of things, and majority of the time the words that they're using are verbs, important verbs. And those verbs are really important to identify because they are usually used in the question. Okay, so verbs are generally regurgitated in the question. So make sure that you're understanding first of all, what is a verb, and realizing, for example, if they're using pronouns, so names of buildings, names of countries, that's an easy way to kind of look at the question and then look at the text as well. So pronouns and verbs, try and remember that. The second bit here is identify extreme language. So can anyone tell me in the chat, what does extreme language mean? Have a think about that. What does extreme language mean? What's an example of extreme language? Yeah, absolutely. So all or nothing, or always, or never, must. So basically it's kind of one extreme or the other. Okay, again, so important for verbal reasoning. I want everyone to just even create a list of some of the kind of extreme languages that you know. So everything, always, that's a really, really common one that they like to use always in the text. And if something is, if it says that in the text that, oh, something is always like this, then that's going to give you a bit of a hint in terms of how to answer the question, because you know that the writer is going to, it basically agrees with that statement all the time. Okay, it's a piece of extreme language. There's nothing ambiguous about extreme language. That's why it's useful for you. So try to remember that extreme language is very, very useful to make sure that there's no ambiguity in the way that you're answering questions. So this third part is don't miss out the true, false, can't tell questions. Every single year, students, for some reason, don't have enough time to do these questions, the true, false, can't tell, and they just skip them for some reason. So the true, false, can't tell, you literally have a 33% chance of getting it right because there's only three answers there in front of you. So don't skip it. Can anyone tell me just in the chat if something can't tell, what does that mean? So when would you choose can't tell on a question? So something's either true, it's false, can't tell. So yeah, exactly. So it's not explicitly said in the passage. That's the most important word. So Pia, well done. It's not explicitly said in the passage. So again, can't tell is actually quite common. So don't think that, oh, can't, it's either going to be true or false. We rarely answer can't tell. If it's not talked about in the passage, or if it's quite ambiguous, if there's a bit of ambiguity going on, then you don't use can't tell. So what's my top tip for verbal reasoning here? Well, it's this link between extreme language and true, false, can't tell. Can anyone try and think about the link that I'm trying to make here? So if the writer is using extreme language, do you think which one of the three out of true, false, or can't tell is it most likely not to be? Yeah, absolutely, can't tell. There we go. So, I haven't even given you the text and I haven't even given you an answer, but already, just by identifying some extreme language like must, always, never, that most likely is not going to be a can't tell answer because there's something very rigid about that statement. It's very obvious. So that's something to bear in mind. From there, you're going from 3 answers to 2. So even if you have 10 seconds to answer the question, you're giving yourself a 50% chance of getting it right. And that's what it's all about. It's all about being efficient with your time. Okay. Another top tip is don't go fishing and looking around for the true, false, can't tell questions. They're actually quite rare. So they come up maybe every 10 minutes, you might have the true, false, can't tell question. Okay. So it's not very common. And that's quite obvious because, true, false, can't tell, there's only 3. So you're giving yourself a 33% chance of getting it right each time rather than 25% or 20% if they have 4 or 5 answers. Look at the conclusion first for author questions. Okay, so this is another top tip. So sometimes the author likes to come up with some statements. I think I've got a statement coming up here. Oh, there we go. So sometimes the author likes to say things like this. According to the passage, the writer most probably agrees that, or according to the passage, the writer believes that. Or they might say, according to the passage, the writer would like to change something. Okay. Now, what's my top tip here? Well, my top tip is anything relating to what the writer believes, try and go to the end of the passage. Try and read the conclusion. Try and read the end of the passage. And generally, the answer is there. It's rarely at the beginning. It's rarely kind of in the middle section. It's generally in the conclusion of the passage. Okay, so something to bear in mind. Again, a bit of a top tip there. When you're practicing questions, if you get anything relating to the writer and the writer's opinion, then try and look at the conclusion. Look at the maybe the last couple sentences, for example. Okay. And again, like with anything, if you're taking too much time, you move on to the next question. You don't need to faff around and waste time on that question. This is more of a top tip for a bit later on down the line. So when you're practicing timing, that's going to be a bit more important. So what works best for you? So in terms of verbal reasoning, if I just ask, well, this is just an open question. What do you think that you should read the passage first, or should you read the question first? What do you think? What if anyone's tried verbal reasoning questions, what techniques have they tried already? So do you try the question? Do you read the passage? So yeah, some people are saying that the passage takes too long, so maybe they go for reading the question first so that they can pinpoint exactly what is said in the passage. Okay, so there's lots of different techniques that you can use. I'll just go through some of them here. So try reading the question first, then the passage. So again, I want you to do this in a trial and error way. So I want, for the rest of the week, when you're practicing verbal reasoning questions, I want you to try and read the question first, then move on to the passage, okay, and try and identify where it is in the passage. If it works well for you, then keep that up. If it doesn't work well for you, well, maybe try a different technique. The second technique you could try is try and read the passage in detail and then answer the questions one at a time quite quickly. So that means if you feel like you're quite a slow reader, perhaps go through and read the passage in as much detail as you want, and then really understand it, and then answer the questions. Okay. Will you struggle with timing? Potentially, but try your best to do that. Oh, I keep on changing slide there. Okay, and the last bit is try skimming the text, then referring to the question. Okay, so I read a book a while ago, about a year and a half. I can't even remember the name of the book, but it was actually giving some advice about how to read faster. So I've got a couple kind of things that I would like people to try and do when they're practicing. So how can you try and read faster? Well, the first thing is that the average number of words in a text in the verbal reasoning is, I'd say, about 200 to 300 words. That's on average. So if you've just got any random book, just get a book from a library, just get a random book and try and work out roughly how many 200 to 300 words are. Then what I want you to do is read those 200 or 300 words and set a timer and time how long it takes for you to read it. So just read it at the same rate as you would just reading a book, okay? And write that time down. Then what I want you to do is try reading that passage, about 200, 300 words, as fast as you can. And again, time it and see how fast it takes. And then finally, what I want you to do is try and skim the 200 and 300 words, and again, time it and see how long it takes. So it's a really nice exercise to do, and I'd highly recommend doing this because it will give you an idea of how long it takes for you to read about 200 to 300 words, and you'll realize how fast you can start skimming. So again, a lot of people have asked me, Shivam, how do I skim? How can I improve my skimming techniques? Well, one thing that I'd recommend doing is, if you are reading a book, for example, try and cover half the page up. And that's a nice way to practice skim reading. So what you're trying to do is, you've got your book there, get a piece of paper and cover up half of the book and just try skimming through the words like this, and then uncover that page so you can see the whole page, and then try skimming. So that's a technique that I read about and I have kind of seen, and it actually works for me quite well in terms of improving the speed of skimming. So try it, see if it works, okay? This, again, is very personal. It's all about trial and error. It's trialing these techniques, okay? So Rita, just to clarify, so my tip for skimming or reading fast would be practice reading a text or a book and cover up half of it and try and skim through that kind of line, and then uncover and then try and go through the book and read the whole page. Okay, so that's the technique: is get that book, get a piece of paper, cover half of the page, and then try skimming down the page like this, and then uncover and try and read everything. And that's just quite useful for skim reading. Okay, try it out, see if it works. It probably will work. Perfect. So I'll just go to the next slide. I just want to, maybe the last thing I want to say on this screen is this bit here. Don't spend too long checking. So a big tip for verbal reasoning is, please, in the exam, do not flag verbal reasoning questions. Can anyone tell me why you wouldn't flag questions in verbal reasoning? Any idea? Rita, do you mind if you can turn your microphone on, if that's okay? Do you mind just telling me, why do you think flagging verbal reasoning is kind of not the best technique to use?
I'm not really sure, but is it like, because, sorry, I don't know.
Okay, so I'll give you a clue. So if you were to flag, for example, a quantitative reasoning section, a question, it roughly takes about 20-30 seconds to kind of maybe answer a question like that, or maybe 40 seconds. Why is that different from verbal reasoning, when you actually have a long passage and then you have lots of questions to answer on that passage? So why do you think you shouldn't flag? Or what I'm trying to say is, if you're struggling with the question, why should you not kind of come back to it a bit later on? That's what I'm trying to ask.
Because it takes too long anyway, so you can go to like shorter questions.
Yeah, so I think a lot of people in the chat have helped you out here in terms of kind of giving a good idea of the fact that you're wasting time already going back and reading that passage again, and it's so time consuming. So I really highly recommend, if in the verbal reasoning section, try not to use the flagging technique. Try and just answer the question there and then. If you're struggling, then maybe do some kind of guesses, and then move on to the next one, because you'll just be wasting time for sure. Okay. It's really difficult going back in verbal reasoning and then rereading a passage and kind of trying to remember, oh, what was this passage trying to tell me? I hope that makes sense, Rita.
Yeah, it does. Thanks.
Perfect. So just a bit about decision making. Again, I've just got some bullet points here, but I'll just go through kind of step by step. So the first one is kind of decision making. Again, is the problem solving section. So technique is probably the most important thing in decision making. It's how can you answer questions logically. So one of the tips for decision making is learning how to use Venn diagrams for those syllogisms questions. I don't really want to go into too much detail about this today, because when I talk about decision making in a few more weeks, then I'll go through it. And so when you are practicing questions, try and use the Venn diagram. Okay, try and create a Venn diagram for yourself, and that might be useful. Again, anyone who doesn't know too much about using Venn diagrams, I'd highly recommend going onto our YouTube. I think we have a couple videos about Venn diagrams and how to draw them and how they're going to be useful for you. But that's a technique to use for syllogism questions. Another technique is in decision making in particular, is learn what spatial equations are and practice algebra. So I'll give you an example. I think it's on the next slide. Here it is. So this is an example of a spatial equation. Don't worry about A and B. I just want you to be familiar with, basically, you've got shapes and it's an algebra. Okay. So top tip for spatial equations. Well, the first thing is, whenever you can, remember in algebra, anything on one side and anything on the other side, if they're on both sides, you can cancel straight away. So just bear that in mind. It's a technique that people forget about, but this diamond here, there's a diamond on the left hand side and the diamond on the right hand side. That means that you can basically get rid of both of them. So what it's saying is that the arrow plus the star is equal to something. Okay. So again, that's a really top tip. Do you need to draw out the algebra on a piece of paper? No, most of the time you don't. The key to spatial equations is you actually need to replace shapes with shapes that you know. Okay, so that's the top tip for spatial equations, is replace shapes with shapes that you already know. Okay, so I'm not going to go through an example, because again, I'd really like to go through that when I go through decision making specifically. But a question might have maybe 4 lines of algebra of shapes that are kind of look like algebra, and then you would have to work out, okay, what is the answer? What is the question mark? Is it the star? Is it the pentagon, the hexagon, for example? Okay. Again, with decision making, flagging is not really recommended. I mean, generally, the 2 things I don't really like in the Ucat are the calculator and flagging. Okay. Students get caught up in those 2 all the time. They use the calculator too often, and they also use flagging very, very often as well. If you can't do the question, guess and then move on. Okay, try not to come back to it a bit later, because that will just be wasting time. Okay. Another part, again, someone asked me last week about this. They said, Shivam, the reason why I skip questions is because I'm going to be negatively marked. And I was like, oh no, absolutely not. So in the Ucat, you don't get negatively marked at all. So even if you don't know the answer, guess. Okay, make an educated guess. Never leave anything unmarked or unfilled. Okay. And again, generally with decision making, it's problem solving, it's problems to solve. And the kind of tip for decision making is try and be quite systematic in the way that you're answering questions. So with syllogisms, with syllogisms, what they basically are is they're maybe 4 or 5 statements. So try and go through each statement and use elimination. Okay, so try and use elimination. So try and in the answers, try and actually eliminate answers immediately, because sometimes it says, oh, Ben has a red hat. He doesn't have a blue or a green shirt. Well, that means that his shirt, is not going to be blue or green. So you can start kind of eliminating things in the answer straight away. Okay, so just to clarify, Aisha, you can't bring your own calculator. You actually have a calculator on screen that you have to use. And it's quite difficult to use. It's not the most high-tech thing in the world. So just make sure you're not wasting too much time. Here is the calculator. This is what it looks like, very old school. The kind of tip here is making sure that you are practicing your mental maths. So one of the things that I'd recommend doing is go online and print out a 12 by 12 times table, and just make sure that you're practicing all your times tables, all the way from, your 12 times 12, making sure that 7 times table, 8 times table, they're common ones that come up all the time. And the final thing that I'd say about learning things are, make sure you know your decimal places. So make sure you know what, for example, 1/8 is as a decimal place. Okay, really important to remember things like that. What is 1/16 as a decimal place? Well, that can help you, when you're answering questions, and it can just help you get questions a bit faster. Okay. So again, don't want to dwell too much about quantitative reasoning, apart from just clarifying to you that if you are practicing mental maths during the week, that is a form of revision for the Ucat. Okay. So you might say to yourself, oh, I haven't done any revision this week, even though you're practicing mental maths, you're practicing your decimal places. That indirectly is lots and lots of revision. Okay, it's going to pay dividends at the end. Perfect. So abstract reasoning. Now, abstract reasoning, you should get into the habit of learning this. It's called SPONCS. Okay, so SPONCS, SPONCS. Okay, so what do they all stand for? Shape, position, orientation, number, color, and size. If you don't know what SPONCS is by the end of today, just please learn it. If there's one thing to take home from today, it's SPONCS. Okay, please write it down, be aware of it, stick it up on the wall. And this is a nice way, when you're approaching any abstract reasoning question, you can think at the back of your mind, okay, let me look at the shape. Are they all circles? Are they all squares? Let me look at the position. A lot of abstract reasoning questions like positionings. So what do I mean by that? Well, sometimes the shapes are always in the right-hand corner, the right top corner. They might be on the sides rather than the corners. They might always be in the middle rather than the outside. Okay, so positioning is quite important. So think about, okay, what do I notice about the positions of the shapes? Are they all symmetrical? Are they all next to each other in a line? Orientation, again, orientation is quite similar to position. So orientation means, generally, when I think about orientation, are the shapes moving in a particular direction? Are they generally moving anti-clockwise or clockwise? Okay, so something to bear in mind. It's very common actually for shapes to turn either 90 degrees or 180 degrees. So that's something to bear in mind. Is the orientation of a shape changing? Numbers. Oh, well, this is one that I don't want people to get too caught up on. People love counting the number of shapes in a box. There might be an odd number of shapes and even number of shapes. That is to some extent important, but actually people get quite caught up on counting the number of shapes. Is it 3 shapes, 4 shapes? Actually, most of the time, the abstract reasoning is relating to the shape or the orientation or the position rather than the number of shapes there. So that's a bit of a trap, a red herring, as to say. They try and catch you out with the number. Okay, so yes, think about odd or even, but don't get too caught up on numbers. Colors. So can someone tell me? Well, it's either going to be true or false here. Can you have the color red or the color blue, for example, on a shape in abstract reasoning? Yeah, absolutely not. So there's no colors to say. So what do I mean by colors? Can anyone say, what do I mean by colors in abstract reasoning? If you can't have blue or green or red. Yeah, absolutely. So you can have shading. So you can have, it can either be black, it can be white, it could be a gray. And yeah, just be aware of that. Is the color changing? If you have a circle, and so let's say you have a circle and a triangle in each box. Well, every time there's a circle, the triangle is always black. Okay. There might be another rule that if there's a pentagon, well, if there's a pentagon, then the triangle is always going to be gray, for example. Okay, so color is very important to be aware of. And then finally, size. So what can anyone tell me a bit about size? What do I mean by size of shapes in abstract reasoning? Yeah, so again, the size of a shape can change. Changes in size are also like patterns. You're absolutely right. So sometimes the circles could be getting bigger. Maybe they're getting bigger around the square. Maybe they're getting smaller around a square. I don't know. But this is really, really nice to use. So maybe at the start of the exam, the first thing that you could do is actually just write sponks on the whiteboard that you get given in the exam, just as a nice prompt, as a nice reminder. Okay, so hopefully I just want to clarify that abstract reasoning is not as scary as you think. Okay, if you have a method in the madness, then it really, really helps. So try and use this, try and use sponks. Okay, and then finally, I'll just talk a bit about SJT. So what's the best way to prepare for SJT? Definitely the best way to prepare is read the GMC guidelines. Okay, so can someone tell me, Victoria Palmer, do you mind just telling me what are they trying to assess you on in the SJT? Again, you don't need to know exactly. What does...
I'm not entirely sure, but I think it's about like your ethics and the things you do in certain situations.
Yeah, so SJT, just to clarify, is the situational judgment test. So you're absolutely right, Victoria. They're trying to check how you would judge a particular situation. Are you being ethical in a particular situation? So for example, if you were a medical student, would you be able to carry out some complicated surgery? Well, of course you can't. Okay, you need to know the limits of your role. If you're a senior consultant, for example, then you still need to know some of the limits that you might have. If you're performing surgery every day, well, you might not be as competent in another type of examination, for example. Okay, so the best way to prepare for this is try and read the GMC guidelines, go onto the GMC website, and the best place to look at, for example, is the GMC expectations for medical professionals, so for doctors and for medical students. And try and have a think about what are some of the themes that keep on coming up in there. So can someone tell me, what are some of the themes that might come up on the GMC guidelines? So I'll give you one. Maybe professionalism is definitely a theme that comes up. You're absolutely right. Consent, confidentiality, medical ethics, capacity. Perfect. So if I ask Angela, do you mind just turning your microphone on for me and just explaining to me a bit about what does capacity mean?
I would say the ability to make decisions, like informed decisions, if that makes sense.
Yeah, so let's say, for example, Angela, I'm assessing your capacity, for example. So what are some of the things that I would try and do when I'm assessing your capacity?
I'm not entirely sure.
So, Angela, if I said to you that, okay, Angela, we are going to give you some medication today. The reason why we're giving you this medication is to help with the cough that you're having. Do you mind telling me what I've just told you? Do you mind just kind of repeating what I've just told you? And say, for example, Angela, you weren't able to do that. Do you think that would be kind of affecting your capacity?
Yeah, because would memory be something you would be assessing when you're assessing?
Yeah, absolutely. So a really nice way to remember this, Angela, and to everyone, is the best way of assessing capacity is, can someone actually think about words traveling in the air? That's how I like to think about it. So first of all, can they understand what you are saying? Okay, so that's the first thing. The next thing is the words going on in their brain. So the next part is, can they kind of weigh up what you're talking about? And then finally, can they then communicate that back to you? Okay, so it really is a nice process, is can they understand what they're saying, or what someone is saying? Can they weigh up the advantages, the disadvantages of what you're saying? And then can they communicate it back to you? Okay, so can someone actually tell me an example where someone can understand what you're saying, can process the information, but then they can't communicate it back to you? Can anyone think of an example there? Yeah, Jack, do you have an example?
Maybe if somebody's having a stroke and they aren't able to completely comprehend if they've lost motor function or verbal function.
Yeah, absolutely. So if they had a stroke, that might have impaired their voice box, their ability to contract the muscles and actually speak. But then, Jack, is there a way that they can still communicate with us if they can't speak?
You could be creative, I guess. You could say blink once or blink twice if they're able to blink. If they only have sort of unilateral weakness, maybe the other side that does work, maybe hold up a hand if they're happy with that, maybe. Out of interest, would you be if they've got family who are their primary carers and they weren't able to make that decision themselves, could you actually ask the family to make that decision on their behalf?
Yeah, so that's a really good question, Jack, because family involvement is very important when making decisions, especially for elderly people. Now, I can't give you the kind of exact yes or no answer there, Jack, because everything is very situational dependent. Sometimes patients have actually signed a declaration to say that, okay, if I become ill and I don't have capacity, I would like my son or daughter to actually make decisions for me.
Yeah.
So that's generally what people have. They maybe have written something down, or maybe they have told the doctor explicitly beforehand, Jack, that actually, if I do become ill, I really would like, my son or daughter knows
Mm-hmm.
best for me.
Yeah.
So that's generally what would happen.
Okay, fab.
Yeah.
That's brilliant. Thank you.
So talking about capacity is really important because, like Jack said, someone could have had a stroke and they might not be able to speak. Does that mean they don't have capacity? Well, absolutely not, because they could still blink. They could still point to maybe A, B, C, D, E. They could point to yes or no. So actually, they could still be able to understand what you're saying, process the information, and yes, they can communicate it back to you. Maybe sign language, for example. Okay, so capacity, really, really important. Again, people have also mentioned things like non-maleficence, beneficence, so doing things for the best interest of patients. My top tip for situational judgment, this is, again, you're going to take anything away from today, please take this home, is if it affects patient safety, it's a big deal. It's a really big deal. Okay, so take patient safety very, very seriously. So for example, you might have been drinking some water on the ward and you might have spilt some water on the floor. Well, if you've got elderly people walking around, that water might be a hazard for them slipping over, and that could compromise patient safety. So is that important? Well, yes, it is. Okay, it's important to maybe clean it up, to do something about it. So I know that's a silly example that I've given. It's the only thing I can think of off the top of my head. But what I'm trying to say here to clarify is anything affecting patient safety is absolutely important. Okay, it's the most important thing actually when we think about it. Okay, the kind of key principle for doctors is making sure that patients are safe and that their well-being is looked after by nurses, by doctors, by healthcare professionals. Okay, so something really important to bear in mind: patient safety. Don't forget that, please. Okay, so that's the QR code for joining that WhatsApp group if you haven't already. If anyone has any particular questions, then again, just put your hand up. I can answer them now. But I really, really hope that today was just giving you a nice insight into the Ucat. Again, Ashir is going to copy and paste these onto the group, onto the chat as well. So if you want to use the free resources that we have at MedicMind, definitely look at the website. We've got so much available. So yeah, please check it out. So Adam, you've said, what is Gillick competency? Again, I'll go through that in a few weeks' time in a bit more detail. It's relating Gillick competency, and also another thing called Fraser guidelines are quite common. It's relating to competency as a young person. So technically, all adults are competent people. Okay, so if you go up to any adult in the hospital, you should assume that they are competent. If someone, for example, is 12 years old, you assume that they are probably not competent. Okay, and that's where Gillick competency and Fraser guidelines comes into that. It's about how are you starting to assess competency in a younger person. So yeah, Esfa, did you have a question?
Yes, I did. I just quickly wanted to ask, obviously some of us have UCAS exams going on. Do you recommend us starting practice questions now or waiting for the 6 to 8 week period?
It's a really, really good question, Esfa. What I would say is, obviously your priority has to be kind of the exams that you have at the moment, but I also want you to have a think about the importance of this UCAT exam.
Yeah.
Because at the end of the day, you know what the entry requirements are for medical school. Generally, it's going to be on the lines of kind of AAA, A-star AA, maybe AAB in certain medical schools. So you know roughly kind of what entry requirements are required from you. But, you could get 1,000 A-stars at A-level, but if you have a poor UCAT score, you're not going to get into medical school. Does that make sense?
Yeah, so, it does.
So what I'm trying to get at here, Esfa, is you need to think about what are you trying to prioritize here. So of course the exams are very important, but also you need to realize the importance of the UCAT exam. So to answer your question in kind of a sentence, I'd say yes, I would try, if you can, even if it's half an hour, 1 hour a day, just maybe spend a bit of time going through the UCAT, go through some questions, go through some of our YouTube videos that we have. And again, a lot of people have asked me directly on the chat about one-to-one tutoring. That's something we absolutely specialize in. So just check out our website if that's something that you want to do. If you want to be a bit more efficient with your time around exam time, then look into that as well. So I hope that answers your question.
Yeah, it was great. Thank you so much.
No worries at all. Vicky, did you have a question?
Yeah, I wanted to ask, in terms of like mental maths practice, is there any websites or apps that you would recommend using like daily, or what you would recommend I would practice it?
It's a good question. I can't think of anything, Vicky, off the top of my head. The best thing I would say is if you just type in on Google like mental maths questions, sometimes they have kind of stuff that you can do online, like just typing in numbers, and they tell you like, oh, what's 8 times 7 and things like that. That's maybe something to look at and to maybe focus on. Other than that, I can't quite think of anything off the top of my head, Vicky. I'm sorry. But one of the things I would say is practicing kind of your times tables in particular, and your division as well, because division is something we can't, we're not very good at. So think about how can you do that really quickly on a whiteboard, for example.
Yeah, thank you very much.
No worries. Simran, did you have a question?
Yes, hi. So I have a general question regarding UCAT.
Does it matter which section we start with first, or is there like a certain order we need to follow?
So there is a certain order. The order is the same every single time, and it's always going to start with verbal reasoning. It's going to go to decision making, and I think abstract reasoning, quantitative reasoning, or the other way around, and then finish with the situational judgment. So it's always in the same order. So just bear that in mind. So basically the first thing you'll be doing is verbal reasoning every single time.
Thank you.
No worries. Esther, did you have another question, or was that just a hand up?
Sorry, I kept my hand up.
That's all right. Okay, perfect. So again, just to clarify, there it is on the screen. So you go through verbal reasoning, decision making, quantitative reasoning, abstract reasoning, and situational judgment. Okay. Again, once again, thank you very much. I really hope that this was useful. We'll be carrying on everything next week. So definitely join that group chat. Make sure that you're kind of free next week as well. Try and interact like everyone did today. That was really, really great. But no, it's been a pleasure. Thank you very much again, everyone. Have a lovely rest of the evening. Keep practicing. Remember all those top tips that I've given you today. And hopefully I'll see everyone next week. I'll hang around for the next few minutes or so if anyone's got any burning questions. But again, have a good evening. Keep practicing, working hard, also rest, think about the exercise as well.
Hi, Shivam. I just want to ask you about one of the strategies I have heard about verbal reasoning. And so I have heard that sometimes people attempt the first 9 passages properly and then just guess the last 2 just to increase their chance of getting better marks. Have you ever heard anything along the lines of that? And do you suggest any of those strategies? Yeah,
so it's a really, really good point. And it's something that I recommend trying to do by trial and error. Okay. So everyone, it's because obviously I can't tell you, yes, absolutely do that. Okay. But what I can say to you is if you feel like that mentally gives you more time to answer questions, knowing that you're not going to answer like the last 2 or 3, then you're giving yourself more time, and it actually mentally you sometimes feel a bit focused on those particular questions. Okay. So perhaps try it, see if it works for you. But what I would say, maybe a different technique to that is if the question looks very, very, very long-winded and very challenging, those are the questions that you skip straight away and you give a good guess at. Okay. So actually, do you see what I've done there? Rather than skipping the last 2 or 3, which actually just it might be very easy questions, you're actually trying to skip those really challenging ones instead. Okay, great, thank you. No worries at all. Ikran, I'll answer that last question and then I think we'll call it a day today.
I was wondering if you could do would you recommend doing the Ucat and BMAT at the same time, like doing both of them?
Yeah, so a good question. So Ucat, BMAT is required for, I think off the top of my head, 7 or 8 medical schools. A lot of people like to do the Ucat and the BMAT exam because sometimes they like to go to some of those London universities. They would like to go to those BMAT universities. So I would recommend, if you want to increase that chance, then perhaps sit that BMAT exam. I myself didn't actually sit the BMAT exam. I only sat the Ucat, and the reason why is because I sat the Ucat and I was really happy with my result. And I said to myself, you know what, I'm going to focus on those Ucat exams and not worry about the BMAT exam at all, because it's one less thing to worry about or stress about. So it's just completely up to you. It's very situational dependent, Ikram.
All right, thank you.
No worries. Simranjot, last question.
Yes, sorry about that. So I have a question regarding GAMSA, if that's okay. So, you said that medic mentor offers a mentoring. So is the mentoring only about Ucat, or, does mentoring also cover GAMSA or BMAT, for example?
It covers everything. Okay, so the beauty of the Medic Mind tutoring is that, let's say, for example, you book a certain number of hours, you can use those hours for Ucat tutoring, BMAT tutoring, GAMSAT tutoring, personal statement help as well. So that's the beauty of it, is it's very kind of interchangeable in that sense. You're not fixed on one thing.
Thank you.
No worries at all. All right, guys, we'll call it a day there. Any other questions, just drop a message in the chat quickly now. And yeah, really hope that this was useful today. If you've got any questions or anything, just make sure that you ask them next week, and I'll be more than happy to answer them. But yeah, take care everyone, and have a lovely rest of it.